Good afternoon, everyone. We are live today at Aster RV Hospital at JP Nagar. I have with me the well-renowned Dr. Vijay Agarwal, who is the lead and senior consultant at Aster RV Hospital for medical oncology, and we are going to discuss with you on the topic cancer and their types. So, doctor, my first question to you would be, what is cancer?
So basically in our body there are cells that grow and cells that die, and normally they grow and die in some sort of a harmony. Now when the growth becomes uncontrollable or the cells don't die, they start to accumulate in the body, they start to spread and they start to cause problems. So this is what a cancer is essentially: uncontrolled growth of normal cells which can become cancerous and grow, and they spread to other parts of the body, and when they spread we call them metastasis. So there are basically 4 stages of cancer. The first is essentially the tumor growing within the organ itself. Second stage is they can grow a little bit larger in size or spread to the nearby lymph nodes. In stage 3, they spread to the loco-regional areas, and stage 4 is when they spread to other parts of the body. And it is only when they spread to other parts of the body they start to cause a lot of problems for the patient and can be life-threatening. So essentially this is what cancer is.
Thank you, doctor, for enlightening us on what is cancer. Now the most important question that comes to our minds is, what causes cancer?
So thank you, Mayur, for asking me that. Basically, when you talk about causes of cancer, we segregate them into 3 different groups. The one group is basically you have the bad genes. The bad genes you've got from your parents, from your mother, father, or or it runs in families. And when you get the bad genes, you can develop cancer. So we know that certain genes such as BRCA can predispose an individual to developing breast cancer or ovarian cancer and so forth. The second group, I classify them as environment. So the environment that we live in, such as road traffic pollutions, or we are exposed to some sort of a nuclear radiation that can cause cancer. And the third is what the most important reason is: our lifestyle. The lifestyle where we live in, what we eat, what we drink, how we behave, that induces or increases the risk of developing cancer. So such as tobacco. So we know that the commonest cause of lifestyle modifiable factor that causes cancer is tobacco, and nothing as such comes close to tobacco. So the vast majority of the cancers that we see which are related to lifestyle is because of tobacco smoking. As much as 40% of our cancers can be prevented if tobacco did not exist in society. Apart from tobacco, you have alcohol, increased consumption of alcohol that can cause cancer. Apart from that, you have obesity. And increased consumptions of meat and processed food is also associated with cancer. Incidentally, increasing the amount of fruits and vegetables reduces the risk of cancer. Also, exposure to sunlight can cause certain types of skin cancers. Infection is another important cause of cancer. We all the time negate the risk of infection as a cause of cancer, but certain infections such as hepatitis B can cause liver cancer. We know that most of the cervical cancers are because of infections called HPV infections. HIV can also induce cancers in the body. So certain types of cancers certain type of infections can cause cancers, and we need to be aware of that as well.
Thank you, sir. So usually we have the notion that cancer is very deadly, but I also want to know, how can we diagnose it early so that it doesn't become deadly, and I want to know how is it curable or not.
Yeah. So thanks, Mayur. So basically when we talk about cancer, like I mentioned earlier on, there are 4 stages of cancer. You have stage 1, 2, 3 and 4. By and large, most cancers in stage 4 are not curable, and most cancers in stage 1 and 2 and sometimes 3 are curable. So identifying cancers at an earlier stage increases the risk of curing the patient rather than identifying them at a later stage. So the early symptoms is not always easy to catch, because what happens is the tumors are very, very small at an early stage and they don't always cause problems. However, certain types of cancer such as breast cancer, we see most of the breast cancers at an early stage because women can feel the lumps in their breast, and obviously the generic notion is that, and there's a lot of education that goes on, that all women should be examining their breast once a month on a regular basis, particularly if they have a high risk of family history. Also, undergoing mammogram once a year or once every 3 years, depending upon the risk factor, helps us identify breast cancers earlier on. And we know that even up to stage 3 breast cancer, the chances of cure is pretty good as opposed to diagnosing them in stage 4. When we look at other types of cancers such as cervical cancers, we know that doing a pap smear once every 5 years, our ability to catch the tumor at a precancerous stage is very, very high, rather than waiting for the cancer to develop and then treat, because then the cure rate actually drops. So So doing a pap smear once in 5 years is useful in helping us try to identify the cancer earlier on. Again, when you look at other type of cancer such as colon cancer, so if someone has high risk factors of colon cancer such as a strong family history of colon cancers, or for that matter, someone has obesity or high waist hip ratio, who we know are at increased risk of developing colon cancers, should get a colonoscopy done once in 10 years, because we know that our ability to identify them earlier on and resulting in a cure is much higher on. So we can't do that for all cancers, but there are certain cancers such as breast cancers, cervical cancers, colon cancers that we can do certain tests, that if you do identify them earlier on, the chances of cure is very, very high. However, one should be vigilant about all types of symptoms. For example, you get a lump and bump, not just in the breast, but anywhere in the body. You need to keep an eye on it, and if it's continuously increasing in size, you need to get medical help. Similarly, when you're having a cough, a nagging cough or shortness of breath, particularly in a smoker, that doesn't go away with normal medicines, then you need to seek medical help. Similarly, with symptoms of indigestion or digestion or constipation of diarrhea or any significant change that does not go away after a few weeks of simple medicines, needs to be investigated for cancer. And that is how we can hopefully catch cancers much more earlier on, resulting in a cure, rather than wait for it to develop in stage 4 and then trying to deal with it.
Sure, sir. So you mentioned a while ago that the maximum percentage of cancer is due to the lifestyle, and almost 40% of cancers wouldn't have existed if tobacco did not exist.
Absolutely.
So can you enlighten me on how to prevent cancer?
So see, the simplest way to prevent the vast majority of the cancers is to stop tobacco in any form, not just smoking. So we know about smoking, but in India, chewing tobacco is very, very common. So if you look at worldwide data, breast cancer is the commonest, breast cancer in women and lung cancer in men. In India, it is head and neck cancer.
Okay.
It is because of chewing tobacco. And if you see, most of our head and neck cancers are on the left side, not on the right side. That is because most people are right-handed and they take the tobacco and put it on the left side. Okay, so there's a direct causative relationship between tobacco, not just in smoking, but also chewing tobacco, even vaping tobacco, or tobacco in any form. You look at cigars, you take it in any form, it is harmful and increases one's risk of cancer up to 25%. So the relative risk increment is about 25%. So there's no point in talking about any other risk factor if someone's a smoker and continues to smoke. So if you stop tobacco in any form, our incidence of cancer would be reduced in society significantly. I mean, we've come a long way, Mayur, since the past 20 years, where the vast majority of the adults were smoking, as opposed to now, which is only about 25 to 30% of the adults smoking. So we have come down because of government interventions in a lot of places, but still we have a long way to go.
Thank you, sir. I mean, it's really scary to know about the cancer and its effects. So to take the topic further, we have a few questions from our viewers, people who are actually viewing it live. So the first question is, why is there a hair loss related to chemotherapy?
Yeah. So when we talk about cancer and we talk about cancer treatment, basically we divide them cancer treatment into 3 different parts. One is surgery, the other one is radiation, the other one is chemotherapy or targeted therapy or immunotherapy or some sort of drug treatment. So not all chemotherapy causes hair loss, okay? But some do and some don't. And I think the doctors will be able to tell the patient and the family that which type of drugs cause hair loss and which type of drugs don't cause hair loss. But yes, the vast majority of the chemotherapy drugs that we use do cause hair loss, and that is by and large usually complete. So there's no patchy hair loss. You can get occasional patchy hair loss, but by and large, when we talk about hair loss, there's a complete hair loss, which usually happens 2 to 3 weeks after starting the chemotherapy. So it's not instant. It's not like chemotherapy is gone in and next day you're with no hair, but it's usually after 2 or 3 weeks the hair loss happens, and over a period of a few days, most of the hair is lost. You can also use not just your scalp hair, but also the eyebrows and things like that can occasionally be lost. But having said that, it is temporary. It will come back after we finish the treatment. So usually a couple of months after treatment, it tends to start coming back, and by about 6 months, most of the hair is back.
Okay, sir. Thank you so much. So there is another question that has been asked. It is about, is cancer genetic?
Yeah, so like when I was talking about the causes of cancer, we spoke a little bit about it. Yes, the cancer can be genetic, but let us not forget, cancer is genetic only in about 10 to 15% of the cases. So in the vast majority of the patients, cancer is not genetic. But in a small group of patients, cancer is genetic. Now, medical science has advanced quite significantly, and we have ways of identifying whether the cancer is genetic or not just by doing a simple blood test. So we can take a blood test, send it to the lab, and we look at about 20-30 genes that are commonly run between families. and try to identify which gene is defective, and then test the rest of the family and kind of advise accordingly about cancer prevention or early checkups that are tailored for that individual. So yes, a small percentage of cancers can be genetic, and we can do a lot to help those people.
Okay, so the next question is, which treatment is better? Is it chemotherapy or is surgery better?
Yeah, so it's not about which treatment is better, it's about what treatment is required for that particular type of cancer. Okay, so for the vast majority of the treatment of the cancers, they need multiple modalities of treatment. What I mean by modality is that I mean that like you have surgery, you have radiation, and you have chemotherapy, and all the three are required at some stage or the other, or a combination of one or two may be required. It all depends upon the type of cancer and the stage of the cancer. For example, in breast cancer, in very early stages of breast cancer, only surgery is enough. But when you start talking about stage 2 and 3 breast cancer and stage 4 breast cancer, you need surgery, you need chemotherapy, you need radiation. So you need all the trimodality treatment. Similarly, when you talk about colon cancer for that matter, early colon cancers, surgery may be enough. When we talk about locally advanced colon cancer, you're talking about surgery and chemotherapy, and where radiation has very minimal role. So again, like I said, it depends upon the stage and depends upon the type of cancer. There is no single modality which is better than the other. For the vast majority of our cancer patients, all the three modalities will be required at some stage or the other.
Okay, sir. So could you throw some light on the government initiatives that the government is taking to curb the increasing rate of cancer in India?
Yeah. So the government is playing a significant role in cancer. Okay. They have various policies and protocols that currently exist and has been going on for a very long time. So we can look them into small bits and pieces. First of all is providing treatment to cancer patients. Okay. So the government has regional cancer institutes that provides treatment to cancer patients. Okay. So in Bangalore we have Kidwai Memorial Hospital that provides free cancer treatment to all the patients who walk into Kidwai Hospital. Apart from that, we know about Ayushman Bharat program, where the government gives hospitals money to treat cancer patients. I mean, in the past year and a half that the program has been active, approximately 5 lakh cancer patients have been treated. In fact, it is one of the highest tertiary care provider for cancer. Okay. So Ayushman Bharat provides a lot of treatment for cancer patients. Apart from that, even for private hospitals, the government has funds. So the health minister has funds, there's a prime minister's fund, there's a chief minister's fund, where patients who got cancer can access those funds for treatment to be done privately. Apart from that, we have central government health scheme, that is CGHS. For all central government employees, they can go to a CGHS empaneled hospital to take treatment, which will be completely paid for by the government. So the government does a lot in terms of providing cancer care and cancer treatment. Apart from that, it also lobbies against prevention of cancer. So we know about the COPTA Act, which is an act against nicotine and alcohol and things like that, where government has put in certain policies and protocols so that you cannot advertise tobacco products, or you have to have statutory warning on the packets to say that it is harmful for health and so forth. If and when strictly enforced, it is a very good prevention. And I like to think that this act has gone a long way in reducing the amount of people who actually smoke. So smoking is banned in workplaces, in restaurants, and so forth. So on that aspect, government is actually doing quite a lot. So for example, even on media, you see tobacco is now put in a bad light rather than a good light. We don't have that many people smoking when you're looking at movies and television and things like that. When we talk about drugs, okay, historically drugs, particularly cancer drugs, have been quite expensive. But government has come a long way in trying to cap the margins of the drugs, so that we know that with the recent price capping, the vast majority of the common cancer drugs are now accessible and available to our patients. It does not matter where they go to; the prices of the drugs have all been capped. So that has benefited a lot of our patients. So I think the government has done a lot in terms of not just trying to prevent cancer, but also in terms of treatment or making it accessible to the vast majority of the Indians.
Thank you, sir. So talking of skin cancer, I have a comment that says, does exposure to sun cause skin cancer?
It does. That's the short answer. Okay. So exposure to sun causes skin cancer. Okay. But however, in India, it's rare compared to the Western population, compared to the Caucasian population. It's because Caucasian population have white skin, and our skin is melanated, is pigmented, and we have brown skin. So that pigment protects us from getting skin cancer. However, prolonged exposure to sunrise can occasionally cause skin cancer to us, but it is much more common in the Caucasian or the white population. So the causes of melanoma, which is the type of skin cancer which people get because of sun exposure, is much higher in the Western world than it is in India.
Okay, sir. And do I need to shave my head before the treatment?
No, not necessarily. So it's a personal thing. So like I said before, not all cancers you get, or not all chemotherapy you get hair loss. In some it might be only mild, in some it might be severe. Some I have had different types of patients. Some patients have said, let me wait till it falls off and then I'll see what to do. For some patients, it's like, no, give me some couple of days, I'll go to a temple, it's a religious sentiment. I go to Tirupati, I'll donate my hair and then come back and then we start. So it's more of a personal thing. There is no requirement, there is no mandate as such that before starting treatment, you need to shave your head.
Okay, sir. And one more question is, how long do I have to rest, in the post-treatment phase?
Yeah, so I think historically it was a myth that when you start chemotherapy, you start some sort of cancer treatment, you have to take rest. So most of our patients actually come, take chemotherapy and go to work. So there is no rest period that is required. The chemotherapy has become so advanced now that very few people actually become very unwell. So like I said, most people come, take treatment and go back to their daily activities. Obviously, we have to be careful about risk of catching infections, and a little bit around that if patients having fever or they're prone to getting infections, they need to stay away from crowded places. But by and large, that effect is only about 3 to 4 weeks from the time you've taken chemotherapy. So I don't think so there's an actual rest period that is required, but most of the side effects of chemotherapy gets worn off between 4 to 6 weeks. So I think we ask patients to be careful for up to 4 to 6 weeks from the time they've taken the chemotherapy. But after that, there is no obvious rest period as such that is required.
Okay, so that brings me to the last question. How many sessions of treatment are required in the post stage, and what is the time gap between each session?
So again, that is very variable between the type of cancer, the stage, and the type of chemotherapy we use. Okay. So we cannot generalize the amount of treatment that is given or the gap between treatment. We have certain regimes, certain chemotherapy that is given every day, certain regimes that is given every week, a certain regime that is given every 2 weeks, every 3 weeks, every 4 weeks, every 6 weeks. It just depends upon the type of chemotherapy we're giving and the combination of chemotherapy we're giving, which is tailor-made not just to the type of cancer, but also to the type of individual that we are treating on. By and large, the commonest regime is either every week or every 3 weeks. Most chemotherapy regimes would last for anything between 4 to 6 months. Okay. But we also have chemotherapy that goes on for up to a year, and chemotherapy regimes that finish within 3 months or so. So like I said, there's a vast difference between the frequency or the interval of treatment and the total duration of interval. And it all depends upon the individual, how fit they are, what kind of cancer they have, what stage of cancer they have, and we tailor make it to that individual. So I think it's quite broad and vague in terms of the treatment protocols that we have, but I don't mean vague. What I mean is that it's stringent to that particular type of cancer.
So you mean it pertains to the type and the stage of cancer as well?
Yes.
Okay, sir. Thank you so much, sir. So that's a wrap. Thank you, sir. Thank you for your valuable insights on the cancer and its types. And we hope we have answered all your queries today. In case you feel you have more questions that we are yet to answer, please write into us and we will have doctor's opinion as a response to the comment. So thank you for joining the session, and we look forward to having another health session soon. Thank you.
Thank you very much.